Good morning, everyone. I'm Bill Miles, President and CEO of the Hilton Head Island Bluffton Chamber of Commerce, and I'd like to welcome you to our weekly Chamber COVID-19 Teletown Hall. Our neighbors in Hampton County and others around South Carolina and throughout the country have taken more than their fair share this week with the tragic tornadoes that hit just a few days ago. Our thoughts and our prayers go out to each and every one of them. You know, it's hard to believe that we're in week 5 of which really feels like month 5 of altering our schedules and dealing with the challenges that come from this pandemic. We've all been learning to adapt to this new way of living and working remotely. We're continuing to introduce new ways to serve our members, non-members, and community in this time of need. Our Lowcountry community continues to show incredible support for one another, and the needs remain great. Yesterday, I had the privilege of handing out our community investment cards as part of the Chamber's partnership with the Watterson Family Foundation and Help for Hope. We handed out 360 cards, which will provide 1,400 meals in an hour and 10 minutes, with cars lined up literally around the block. It was incredible. And the cards will provide meals, also help a business, and keep jobs. We're very, very proud to be a part of this, and also want to salute all the organizations that are doing such worthy things, and continue to encourage you to support all those charities that are in great need and doing great things. The Chamber is continuing to convene, convey, and connect our community. Tomorrow, we'll be partnering with Burr Foreman for a webinar to answer the top 10 burning questions for employers on FFCRA, Families First, and CARES Act. The call will be held tomorrow, April 16th at 10 a.m. And if you have questions about how to prepare and minimize liability for your business, we'll provide a registration link here, and you will also be able to find a registration link on all of our social media. As you all know, each week brings new changes. In the challenge of this pandemic, Governor McMaster has extended his executive order through April 27th. And last week, new changes were put in place by many of our retailers to minimize the spread of COVID-19 and deliver the supplies we need. To talk a little bit about that this morning, we're happy to have Brooke Mueller, and Brooke is the Director of Government Relations for the Walmart stores. Brooke, thanks for joining our call today, and we look forward to hearing from you.
Well, Bill, can you hear me, first of all?
I sure do. Good morning and welcome.
Well, thank you all for having us. So just a little bit of information. I do all the public affairs and government relations for the East Coast states, Virginia and the Carolinas, but I happen to live in the upstate, so have a personal love for South Carolina for all those reasons. Thank you all so much. I'm going to just take a few minutes and kind of go over some of the steps and the guidelines that we at Walmart have implemented to try to keep our associates and our customers safe. And then we have kind of 8 new shopping guidelines that we're starting to push out as it relates to things that we're asking from the customer in order to help us keep them and our associates safe. And then I can go over kind of a few supply chain things. I know some people had some questions as it related to that. So first and foremost, I kind of want to go over just the list, and it's been accumulating as we continue to constantly monitor and adjust our operations in order to meet the demands of these interesting times. So first of all, we have changed our operating hours in a lot of our stores. Our stores that used to be 24 hours that would stay open late are now 7 a.m. to 8:30, unless there's a local ordinance in place that would adjust those hours differently. That allows us to do some deep cleaning overnight. We are abiding by the CDC protocols, as well as we have our own medical advising team inside Walmart that is helping us advise on some of that. Along with the changing hours, we have also adopted some senior hours. Several weeks ago, we made an announcement that on Tuesday mornings, an hour before the store opens, because it's clean and hopefully well stocked from the night before, the hours would be from 6 a.m. to 7 a.m. And then we rolled out yesterday that for our pickup, that we would be adopting on Tuesday mornings special slots for seniors or for those that would qualify through some sort of disability or thing like that, that they would get priority for those pickup hours. We also have started doing health screenings and temperature checks for our associates coming to work to keep our other associates and our customers safe, and that rolled out in the last couple weeks. We have started providing masks and gloves to our associates that want to wear those while they are working in order to try to keep the spread of all germs down. We have started metering into our stores, which I think y'all have probably noticed, which is we're doing 5 customers per every 1,000 square feet, or 20% of the occupancy across the board, in order to try to keep the flow inside a little bit more open. We've started installing plexiglass both over at our pharmacy as well as at the cash registers. Some of that has already been put up in certain locations. Some of it is still rolling out just based on supply. And then lastly, we've done floor decals. You also see floor decals down in the high traffic areas like the checkouts. And we're starting to roll floor decals down one-way aisles in certain locations to try to keep the flow from being too bunched up. So that's a pretty comprehensive list that, Bill, I know you said it's been 5 weeks, but I feel like it's been 5 years as we have tried to adjust and change very quickly to these challenging times. I'll keep on talking because in doing all this, we have also asked our customers to kind of change their habits as well. We, I think, are used to shopping, myself included. I have 3 kids and kind of like, what do I need today? Or how do I need, to process my day? But we're really asking our customers to slow down and to make a list and to try to limit their shopping trips. So some of the 8 guidelines we've kind of rolled out are for our customers to really be mindful of that 6-foot rule when they're shopping in our stores. We don't have to all go on top of each other when we're getting our laundry detergent. Let somebody else get the laundry detergent and then move on. To shop patiently. Remember, we're kind of all in this together, and to really allow that time for that distancing, to limit and to consolidate your trips. Make out a list and see if you can consolidate once a week or twice a week, once a week or once every 2 weeks, and do a big run as opposed to every other day or popping by. Shopping alone. We've had a real challenge in our stores of whole families coming in, and we realize this is challenging times. I mean, I have all 3 of my kids home. I think I lost the Zoom. Can y'all still hear me?
We sure do. Yes, we do.
Okay. My connection here is spotty. But shopping alone, and really, when possible, to just have one person for the family do the shopping is really helpful. Please stay home if you don't feel well. Send somebody else to the store. We're starting to ask if you cover your mouth. A lot of places are implementing masks, but if you have the ability to have a mask, that to please use that as we continue to kind of keep the spread down. Wash and sanitize your hands. I know we've had some challenges with the sanitizing wipes for our shopping carts, which is why we rolled out some of the sanitizing. We've been spraying our shopping carts, and that's just a supply issue that I think everybody's having the challenges with across the chain. But not only are we sanitizing the carts, but we're asking folks to wash and sanitize their hand, and to learn new technology, to shop curbside pickup at home and delivery when possible. And I know there have been some challenges getting some spots, so I can kind of explain that as I roll into my last part of my spiel, which is the supply chain. So a lot of y'all, and we certainly have gotten the comments that they've had a lot of challenges getting pickup spots or delivery spots at our stores that offer pickup and delivery. And so just to let y'all know from our perspective, the rush on the supply chain the last 5 weeks has been unlike anything we have ever faced. So what would essentially, I think our statistic recently was in 5 days, we have sold enough toilet paper that every single person in the United States can have their own roll. And we have been consistently selling what we would normally mark as 3 days worth of supplies in 3 hours. And as you can imagine, that has put amazing constraints on our logistics and our ability to keep the shelves stocked. So when that first big rush hit and our shelves were just wiped out, we did turn down and dial back a lot of the pickup options because frankly, we just couldn't fulfill the orders. The stock was not there. But what you've seen them doing is they're slowly rolling back out the number of days from 2 days to 3 days to 5 days that you are able, as our supply chain kind of catches up and we start getting back in stock with a lot of these items. And we're adding pickup slots to those slowly. We added over 1 million slots last week alone across the US to try, knowing that more and more people want the ability to pick up, but we also want to be able to deliver reputationally on the ability to serve that order. So we are working really hard. Our operations team, our logistics team, I just cannot say enough amazing things about them. Our in-store associates who have really just stepped up to serve the community and trying to keep these items in stock. As it relates to the in-stock, we are starting to do a lot better. The food sources are certainly there. We have caught back up with eggs and milk and meat. The paper supplies continue to be a problem. I think people continue to kind of hoard and buy more than they need in that category. And so we really are asking people, if you've got enough on hand, kind of let the stock get back up. I mean, our suppliers we've been working with, I learned this interesting thing the other day that, if you make a variety of toilet paper, you can't make as much, but if you make just one type, you can keep that rolling. And so I think you're going to see a little bit less of variety as they try to just meet that demand. And then lastly, I would say we are starting to see, as things have moved, I just think an interesting statistic, as things have moved from the food side of the aisle, we are starting to see a real uptick in the game section, the craft section, the home office supply section, the technology section, as everybody's adjusting to this new world order of working and teaching from home. So I covered a lot of information in a short amount of time, and I was trying not to talk too fast, but that was just kind of the overview from our perspective.
Brooke, thank you. And you've addressed a lot of the questions that we've had. I will follow up with one question as it relates to supplies, and it's from Deborah. Deborah asks, when do you anticipate catching up with paper supplies?
I wish, a lot of that is really dependent. Some areas are doing a little bit better than others. It really depends on the hoarding tendencies. We have trucks rolling every day that have paper supplies on them. It's just, can the people that already have the stock of toilet paper and paper towels allow us to catch back up on that supply? So we tend to roll out in the morning, and by the afternoon, it's gone. I will say, just personally, I've had a little bit more luck on Walmart.com versus in our stores because I'll get an order in and they'll fulfill it when it comes due. So I would ask those that maybe have had trouble in the stores to check out Walmart.com. We're rolling with paper every day. There's going to be enough toilet paper. We're going to be okay.
That's good. That's probably a good one to close on. And Brooke, thank you again for joining us this morning.
Thank you so much.
Our next speaker this morning, we're fortunate to have Dr. Michael Katka back with us. And Dr. Katka is with DHEC, and we look forward to your update this morning, Dr. Katka.
Thank you very much. Good morning, and I appreciate the opportunity to speak again. Yesterday, DHEC reported 115 new cases of COVID-19, which brings the total number of people who have tested positive for the disease in South Carolina to 3,553. This includes 29 new cases in Beaufort County over the past week, bringing the total to 205 for the county. Unfortunately, we've also had 46 additional deaths in the state over the past week, bringing our total number of deaths in those who have tested positive for COVID-19 to 97. The virus is widespread in our state and our communities. Half of the counties in South Carolina have experienced one or more deaths among their residents. To support anticipated increases of people confirmed to have COVID-19, we continue to work with our partners, such as emergency medicine and healthcare facilities, to stay updated on the availability of acute care beds throughout our state. We are currently at about 51% capacity where we've kind of remained. There are 5,748 beds available. In addition, a total of 33,872 tests have been run both by the DHEC Public Health Laboratory and private laboratories in our state. About 10% of tests done in South Carolina residents have come back positive. As the response to this global event continues, it is important that individuals continue to take steps to protect themselves and prevent a new acceleration in cases. We must not drop our guard too quickly. Protect yourself and others from COVID-19. People in our communities are getting sick and even dying of this disease, and we can all help prevent this. People 65 and older and those with conditions like diabetes, heart disease, or high blood pressure are at greatest risk. Help stop the spread of COVID-19 by staying home as much as possible, avoiding close contact with others, washing your hands often, and continuing to take your prescribed medications. For the latest information, visit our webpage, scdhec.gov/COVID-19, and I'm happy to take any questions at this time.
Thank you, Dr. Kaka. One question we have here is if you have a regularly scheduled procedure that needs to be performed at a doctor's office, what are the best steps to protect yourself while having that procedure done?
Well, one thing is making sure that you're not having any symptoms so that you're not going in and spreading it. The current recommendation by the CDC is to use a cloth mask if going out in public. So if you're able to kind of fashion together a cloth mask out of some fabric, and there's videos both on the DHEC website and the CDC website that kind of demonstrate the process for making something like this. And that will basically, the reason behind that is if you are contagious but not having symptoms yet, you're more likely to protect others. It may also help prevent you from touching your face when you're out in public, which we all kind of do, even though we've been told not to. And then as much as possible, maintaining that social distancing. I think a lot of the doctors' offices are very well aware of what they need to do to kind of protect their patients. So they're probably taking steps to make sure that the patients are well protected at this time.
Dr. Kaka, thank you, and we appreciate you joining our call again this week. That's going to lead us. We'll transition into Dr. Kelly Beaufort, and Dr. Beaufort was with us last week. We're fortunate to have her back with us this week, and she's the president of the South Carolina Nurses Association. Dr. Beaufort.
Good morning. Thank you so much for inviting me back to the call. And I'm very happy to follow Dr. Kaka. And actually, Mrs. Mueller gave us some really great information. So I think my segment today will absolutely kind of reinforce some of the information that we've already heard. There are a couple main touch points that I would like to follow up on. The first thing that I'd like to actually talk about briefly is that in hearing the numbers from Dr. Kaka, it is really important to remember that our nurses, our paramedics, our physicians, and all of our other healthcare workers are working extremely hard. It's a real dichotomy because the pandemic is, on one hand, something that we have to gear up for. They are in some places working really hard because they are dealing with some surge, but in other places they may not be having surge capacity yet, but they're having to learn how to do new processes for caring for patients with COVID. They may also have to learn new procedures, get new equipment, and do things that they've not done before, set up tents or other specialty equipment. It's very tiring, both physically and mentally. Plus, we're working in gear that we don't normally have to wear. It's hot, it's heavy. So remember that they are working under conditions that we don't normally work in all the time. At the same time, we're asking the public to do some work that they don't normally do, and that's stay home. That's to be mindful. And I really liked about the eight steps or the 8 things to keep in mind. It kind of reminds me of mindful practices. And it's really good advice because one of the things that I keep seeing on social media or things that people text me or call me and say, do I really need to wear a mask? Yes. The short answer is yes. And I brought one, and I don't know if they can see, but it's a simple sewn mask out of sheets that my neighbor made. And not everybody has access to a homemade mask, but if you do, great, wear it. If you don't, you can make a mask, as Dr. Kaka just said, from simple household materials, a bandana, an old t-shirt. I've seen people make them out of a nice thin sock where they folded it, used rubber bands. We can get innovative. But when you go outside to a grocery store or Walgreens or a pharmacy or somewhere for essential trips, please wear a mask. I had to go to the store just last week, and I was really just taken back how many people in our community, the older community, I'm talking probably 65, 70-year-old people that weren't wearing a mask. They're the most at risk and they're the most unprotected. And this needs to be really emphasized because they're likely to get more sick because they have more underlying conditions. And we really need to do our part to be good stewards and set the example. It is really hard and really uncomfortable, but it's the right thing to do. When we go out into public, please wear your mask. It really is something just so simple that we can all do to stop the spread. And I know there's a lot of controversy and you'll see a lot of debates on Facebook about it, but it does filter out some particles, and actually it works really well in the allergy season. So there's a double positive to wearing the mask. The other thing is check on your neighbors. There's a lot of older people that are isolated in this time, and you can still work to check on your older neighbors while we're in social distancing. I would ask that you make sure that they have their food and their medicine and that sort of thing, and limit the 80 and 90-year-old people that are going to the grocery store and to Walmart and to different places. And that way we're limiting exposure to our essential workers in the grocery stores and all these other places, because they are dealing with with people coming and going that may not be wearing masks. We all have to think a little bit outside of our own bubble and make sure that we're protecting each other. We are one community. And until we start acting and demonstrating some care and kindness to each other, we're not going to get through this very well. And we are a great community in Hilton Head. I love living here, and we need to take care of each other and, start thinking in terms of, hey, do you need a mask? I have an extra. Or, hey, do you know how to make a mask? If you don't, I'll make one for you. Or, can I run to the store for you because I have a mask and I'm healthy? And if we can just maybe pay it forward a little bit, maybe we can get through this a little bit easier. So my simple advice is just think about everyone else around us and how we can do this a little bit better. Please don't congregate. Please do the social distancing a little bit longer. We'll get through it. We'll bounce back. We are Hilton Head strong. We came back from Matthew. We got to think in those terms. And, we can just be there for one another, and we will do this. And that's all I have. And I will be happy to take any questions.
Thank you, Dr. Olay. One question we have from Dale here is, what's your opinion on wearing gloves in public?
Oh, that's a good one. Gloves are really not necessary. Gloves do not really offer you any added protection, because one of the things that I see is that people are using gloves and they're still touching everything else and touching their face, and that really just defeats the purpose. As long as you use hand sanitizer and you wash your hands, it's not going to add any other layer of protection. Gloves really are useful if you are dealing with someone that has the coronavirus and you are touching something that's already been contaminated. So remember, it's a droplet or it can be aerosolized, and it's really your face that you really want to protect, not your hands.
Thank you. Another question we have from Ellen. Can you share the proper way to wear a disposable mask, color side in or out, and there's been conflicting information on the internet regarding that, Ellen says.
Well, one thing I'll tell you is the sewers in the community have gotten really good at sewing, and have made designs and have done all kinds of things. This one does have a white center, and it really depends on where your pleats are. So for this particular one, you just want to open it up. The main thing is that you cover your nose and you bring it high enough on the nose, and then you extend it so it's below the chin. So this would go like this, and I would pull it down as far as it could go and over my nose. So my nose is covered, my chin is covered, and my whole face is covered. So hopefully everybody can see that. And I can breathe. And there's about 3 levels of fabric in here.
Perfect. Dr. Boothole,
you don't touch the front.
Perfect. Thank you. Thank you very much for joining us again this week. And we'd love to have you back next week if your time permits, but very informative.
You're welcome. Thank you again for having me.
Thank you. Next, we'll roll right in with Jeremy Clark, who's the Market Chief Executive at Hilton Head Hospital. Jeremy.
Hey, good morning, Bill. How are you?
Very well, thank you. Welcome to the call.
Great, thanks a lot. And I will say it's good to follow Dr. Boothole again. I'm really glad she got the question on wearing the mask. My team has been laughing at me all week for the way I wear mine, so I'm glad she got that one and handled it expertly. As in previous weeks, Hilton Head Regional Healthcare continues to operate safely and effectively. I continue to feel good about the plans that we've implemented and those that we have in case we need them. So I'll continue to give you a little bit more detail on those today. But before I do, I really want to talk about our community. I will tell you that every week has been more remarkable than the last in terms of the support that the community is giving our caregivers. It's really been incredible. It's individuals, it's small businesses, it's other organizations that are stepping up to donate a handmade mask and food to our employees. It really lifts their spirits. And to know that many of the organizations that are making these donations are going through their own personal challenges as well really tells you what a special place this community is and what a great place that we all live in. So I just want to say, I want everyone to know how thankful we are, how thankful our team is for all the support that we're getting here. And we just really appreciate it. At Hilton Head and Coastal Carolina Hospital, we continue to refine our preparations. We, like you guys, we see the concerning images from across the country, and our hearts go out to those patients and the caregivers. But that's not the situation in our community today. But also, like you, we're starting to hear the optimism from certain communities, and we have to remind ourselves not to get complacent. As Dr. Kaka said, we're going to stay vigilant in our preparations so that we can do the best for this community as this situation develops. I want you to know that every day we are providing great care to the patients we have in-house, but also preparing for a surge of patients if that indeed comes. In addition to the things that I've mentioned on previous calls, we just continue to refine our plans. We continue to focus on keeping our caregivers safe. That's allowing them to wear hospital-issued scrubs if they're taking care of patients under investigations for the coronavirus. Everyone on our patient care units is wearing a surgical mask. Everyone who's not on a patient care unit in a more of an administrative or non-clinical area is wearing a cloth mask as well. So we're trying to maintain and work within those guidelines the CDC is giving so that we are all staying safe. We are able to safely cohort all of our coronavirus patients in isolated units where they can really receive dedicated care. We continue to receive new supplies, new personal protective equipment supplies from both existing vendors, but also new vendors as well. So we feel really encouraged by that. We've been spending a lot of time just solidifying our plan for our caregivers as they are cross-training and learning to work on other units. And I'll echo what Dr. Boothole said. They are really putting in an incredible effort, learning new jobs and working under conditions that we never have had before. So they're doing a fantastic job. Continue to strengthen our physician approach, especially in both the ER and with our hospitalists, so that those guys are ready if we need them. Continuing to rehearse and refine our ability to add both ICU level beds in our organizations, but also lower level med-surg beds, and continue to work with state and local officials to provide, to support the provision of care outside the walls of the hospitals, if indeed that we need that. So overall, it's been very busy and a very productive week for us. And I'll just conclude by saying it has been 5 weeks. It has felt longer than that since we started making these preparations and started having these changes in our operations. I continue to feel very good about our people, about the training they've had, about the supplies we have, the equipment we have, and the processes that both we've set in place, but also the ones that we have just in case this surge develops. I want you to know that every day we are spending time focused on taking care of the patients that we have, but also preparing for that surge of patients that may come. These have been challenging times for our operation, and it's been challenging times for our staff. But it's just so remarkable the support that the community has given us, and it helps us continue on and in turn provide great care for the community. So I just want to say thank you for that. I appreciate the leadership from our local officials, and I appreciate everyone's support for our caregivers. With that, Bill, I'll turn it back to you.
Thank you, Jeremy. I have a question here for you from Anna Maria. The question is, are there any plans to set up remote testing sites in the county that you're aware of?
There are some places that are doing remote testing, drive-through testing in the area. I would refer everyone to DHEC as really the source for all testing and remote testing sites kind of throughout the state. I think they've got a pretty comprehensive list on their website.
Thank you. One other question from Jason. This was probably more appropriate for Dr. Katka earlier, but the question came in late. I'll ask you, but probably don't expect you to have the figures on the top of your head. What's the average age of those infected, and what's the average age of death in regards to COVID-19?
Unfortunately, Bill, you were correct. I don't have that. I don't have that data at my fingertips.
Didn't expect you to, but just thought I'd throw it out there. Jeremy, thank you, and thank you to your awesome staff and the great things that nurses and all the healthcare workers are doing. We salute each of you.
Thank you, Bill.
You're welcome. Thank you. We're going to move on now to our next caller and our next speaker, and that's Joe Passman, who's the chairman of Beaufort County Council. Joe?
Good morning, Bill, and everyone who's listening. I'd like to talk about several items. First of all is the budget process that the county is beginning to go through. We had our first meeting the other day about our budget process, and we have set a goal that there will be no tax increase due to the economic conditions that we have. If at all possible, we would actually like to have a tax decrease, but that's going to depend upon several issues that we have to face. The biggest one will be the revenue stream that we're going to have. So the budget process has begun. It will conclude with a budget at some point in the future. Next is the county operations. We have approximately 1,300 employees. We're trying to maintain our staff at the current level we have. But like all other employers, the longer we are shut down, the more likely we're going to have to make some difficult choices regarding furloughs. But at this time, while the physical offices are closed, all of the things that we need to do to be in contact with the citizens of the county are operational. And speaking of county council, we continue to meet as a council, but we're using WebEx video conferencing. We did that on Monday. Our committee system is beginning to operate, and starting next week, they'll be using the same WebEx video conferencing. The public is still able to see and have input using Facebook, email, or they can phone in questions that they have as we meet. And one of the things that we are facing now is everyone is looking to the county for financial support in these troubled times. Our problem is that we have a fiduciary responsibility for taxpayer dollars. So some of the requests are not applicable to what we can do. Surely we would like to have everybody, but there are certain things that we can't do because we're using taxpayer dollars. So having listened to everybody today, I want to talk about or throw this out about the short-term plans and long-term plans for the future. As we're hearing nationally and statewide, we're talking about the possibility of reopening our businesses, reopening our economy. So I'm going to throw this out that we need a strategic plan for the reopening of Beaufort County to ensure our recovery is as good as we can have. And by that, I mean we need to bring together our business leaders, our hospital leaders, our county leaders, our municipal leaders, our school leaders, our first responders, including EMS, fire, police, our transportation leaders, and our communication leaders, all to have input on what would constitute reopening Beaufort County, knowing full well that we are not out of this pandemic as yet until we have a vaccine that ensures the safety of everybody. Precaution is going to be something that we have to do as we reopen. And finally, at some point in time, long-term plans, we're going to have a post-mortem for the pandemic. What worked? What didn't? What lessons have we learned for the next time something like this could happen? And again, we're going to use all of these leaders to have that. So that's what I have this week.
Very good, Chairman. Thank you very much. We appreciate your input. And no new taxes. Everybody always enjoys hearing that. So thanks again for joining us.
Thanks.
Our next speaker is Chris McCorkadale, and Chris is the Senior Vice President of Hargray Fiber and also happens to be the Chairman of the Board of the Hilton Head Island Bluffton Chamber of Commerce. Chris.
Good morning, and thanks, Bill. I want to talk about two things, briefly from Hargray and then just a moment on the Chamber as well. But briefly from Hargray and a communications preparedness point of view, Hargray remains fully operational. We are in a remote working posture, but continue to conduct normal operations across all of our operating territories. That means the continued support of both residential and commercial needs with technician and customer service teams that are committed, really doing fantastic work and that we're extremely proud of. We consider ourselves very fortunate to have the colleagues that are as committed as they are. On the safety front, we continue to use enhanced screening procedures, CDC approved cleanliness standards, and all of our technicians are equipped with personal protective equipment for both the safety of our customers and their own personal safety. Our broadband and communications network is strong, it's performing quite well, and has been able to accommodate the additional demand, particularly from our residential customers and the wireless or cellular carriers that we serve throughout the Low Country and elsewhere. And on that, I'd like to just spend a minute on the demand that we've seen on the network and on our broadband subscriptions. Since introducing our free home internet program for those with K-12 or college students studying from home, we've processed more than 1,800 orders, most of those in Beaufort County. We also have a free upgrade program for our residential customers that has received a similar response with more than 1,600 requests so far. And one of the last points I'd make from a Hargray point of view, and as the economic effects of COVID-19 continue to impact families and businesses across the Southeast, Hargray is pleased to pledge $50,000 to help support the Help for Hope Fund that will provide meals to 1,000 families affected by the crisis, to support local restaurants, and to help save jobs. As many know, and as Bill mentioned, the Help for Hope Fund is powered by the Watterson Family Foundation and in partnership with the Hilton Head Island Bluffton Chamber of Commerce, the Community Foundation of the Low Country, Deepwell, Bluffton Self-Help, the Campbell AME Church, and many others. As has been said, donations are distributed in the form of community impact cards given to families in need at various locations throughout the community, and these cards can then be redeemed at participating restaurants for a family meal. The Hargray team considers itself fortunate to be able to support such a great program. And on behalf of our 800 or so colleagues, we remain committed to our purpose of empowering people and communities to connect and thrive, and would just remind all of you that we're here if you need us. And next, if I could put my chamber hat on for just a minute, as a current board member and the current chair of the board, and on behalf of all our directors, we remain steadfast in our dedication to our members and to the community at large. We continue to see our role during this crisis as being a reliable conduit for timely facts and information from multiple sources at the national, state, and local levels. We'll continue to support the current needs of our businesses during this current phase and have a watchful eye on and look forward to the future. Bill, as many have said throughout these past weeks, I want to thank you and your team for your tireless efforts and your continued dedication. And with that, I'll turn it back to you and answer any questions that may be out there.
Chris, thank you so much. And what a tremendous announcement this morning on the $50,000 investment in the community. And that $50,000, to reiterate, will provide 4,000 meals to 1,000 different families. So 4,000 meals, which will indeed provide a meal, help a business, and keep jobs. Terrific. And thank you to you and the Hargray team. A great need for the community. So thank you, Chris. And we appreciate your leadership on that.
Our pleasure. Thank you.
We're going to transition right now to the president of the South Carolina Bankers Association. President and CEO Fred Green is back with us again this week. And Fred, a lot of great things we heard from you last week are very interesting and needed. And glad to have you back on the call this week. Thank you.
Well, Bill, thank you and good morning. Thanks for including me again this week. I'll give an update on the PPP program. First off, let me just kind of go back. So when we were on last week, I was talking about the log jams, the choppiness of the rollout of the program, and the issues with banks being able to process through the SBA portal the vast volume of applications that they've received. That choppiness has kind of settled out. At this point in time, probably 95% of the 70 banks that operate in South Carolina are participating. All of those banks had to build their process and procedures literally in hours to accommodate the rules as they were being issued and changed along the way from the SBA. But all that's last week and maybe through the early part of this week. Where the banking industry is now is they're reallocating the resources that they had initially set up, manning shops that were working 24/7 to accept and process applications. They still are working 24/7, virtually every bank. But some of those folks are now going into the issuing of the checks, the closing of the loans. So I think just about every bank has been closing on loans, has been issuing checks to the small business clients. There is a goal and an expectation, quite frankly, for every bank to close and fund those PPP loans within 10 calendar days of the approval of the application. We do have kind of hot off the press, the SBA yesterday issued some statistics on the program, and this was as of Monday. And on a national basis, 250 billion of the 350 billion had been allocated. These are the approved applications. More importantly to your audience on the call today, they broke it out by state, and I'm extremely proud of our bankers in South Carolina. South Carolina had 2.8 billion in approved applications on 14,300 small business customers. And to put that in perspective, mentioned on the call last week, SBA last year processed right at $2 billion in 7(a) loans, which is what these are, on an average amount per month. So $2 billion per month on a national basis. South Carolina's 2.8 billion is roughly 50% over that in a 2-week period of time. So that just kind of puts it in perspective in terms of the volume. Some of the questions that I'm getting now and our bankers are getting as the loans are being funded deals with the forgiveness component of it. And as Senator Scott said last week on the call, the at a high level, roughly 2 months, 8 weeks of payroll will be forgiven, assuming that the small business, that component of the loan will be forgiven, assuming that the small business owner maintains that payroll during the period of time. So that's a high level and an attempt and a incentive to keep folks on the payroll. So again, as loans are closed, that's the next step. And all I can say about that right now is that the SBA has not issued any guidance on the application for the forgiveness, the process procedures. I'm sure that'll be coming out over the next couple of weeks. But again, on the high level, it's 8 weeks of payroll, assuming that they're continuing to stay on the payroll. The other frequently asked questions that we're getting has to do with the independent contractors and the sole proprietorships. Up until late yesterday afternoon, maybe even last night, the SBA had not issued any guidance on how to handle those type loans under the PPP program. They did issue it last night. It gives banks the ability now to begin accepting applications and processing them now that they know what information is required, how to calculate the appropriate loan size for the independent contractors and the self-employed. So, Bill, that's just a quick update. I'll be happy to answer any questions. And thank you again for having me on the call.
Fred, thank you. You've answered a couple of the questions we have. We have a couple more. I thought we would go to Greg White, and we'll hear Greg, and then maybe let both of you answer the questions together. And so let's welcome Greg White, the District Director of the U.S. Small Business Administration, as a speaker this morning. Greg.
Bill, thank you very much. Fred, I actually stole a lot of my thunder as far as the numbers and figures of the PPP loans that have been funded. I just kind of give another statistic for you that nationwide, about 13% of the dollars went to construction, about 12% of the dollars went to professional science, scientific and technical services, and about 12% went to manufacturing, and the other 11 went to healthcare and social assistance. So those are some statistics nationwide of where the dollars are going and what industries and markets are going to. Fred mentioned the facts. I'd encourage everybody to go to treasury.gov/cares to look at the FAQs that are on the Treasury website, update you, as Fred said, about the independent contractors and conflicts of interest with directors. And also franchise companies can find some information there on how they can qualify as far as eligibility. As far as economic injury and disaster loans, currently those are being funded. Checks are starting to go out. We're starting to see some movement in that program also. It seems to be going hand in hand with the PPP program at this time. So we're starting to see people get some of the grant advancements and also some of the loans that are starting to close for the economic injury. So that's a positive thing. One of the biggest questions we have a lot of times is about the funding running out. With the $250 billion that we've put out so far, we do know Congress is out there working on a additional package for about $280 billion. So if you want to encourage your congressmen and senators to spread it along, we'd appreciate it, because it looks like the demand for the funding will continue for a fairly period of time. And with that, I'll stop and let answer some questions.
Okay, thank you, Greg. The first question we have is, will there be another call or a discussion? It's a discussion to address the sudden change in the SBA idle 10,000 advance, and that comes to us from Shane.
Could you repeat the question?
Yes, it's asking if there will be another discussion to address the sudden change in the SBA idle $10,000 advance.
Currently, that is based upon yes, go ahead. Can you hear me?
Greg, yeah, Greg, I was just going to suggest you answer that one. I'm not familiar with it.
Yeah, the $10,000 advance currently is based upon $1,000 per employee. There's been no additional changes in that. It's also based on other criteria on the loan amount that's going to be received by the individual, but currently it's based on $1,000 per employee, and that has not changed in any way that we're familiar with at this point.
Okay, thank you. And another question is, what would be the best support product / loan for an organization, a nonprofit organization that is not a 501c3?
Bill,
Go ahead, Fred.
let me jump in, because the 501c3s are included in this original round of PPP. There's been some discussion on the second tranche, when and if approved by Congress, that it would expand to other type of nonprofits. But at this point, the C3s and a couple of others would qualify for the PPP. And Greg, I don't know of any other programs the Small Business Administration might have for other type of nonprofits.
Not at this time. There's no additional programs out there. I'm in concurrence with you as far as the new dollars that are being funded by Congress, potentially, that they are considering that. And there are some other federal agencies with USDA that can look at other nonprofits and government entities that are not covered under the PPP program or the Economic Injury and Disaster Loan Program. So that would be my suggestion, to look at other agencies and even possibly, because they are receiving some funds for that purpose.
All right, thank you, Greg and Fred. Thank you again for joining us this morning. We're going to transition now to the education segment. Or I'm sorry, not education yet. First of all, we're going to hear from Dwayne Parrish, who is the Director of South Carolina Parks, Recreation, and Tourism. Dwayne?
Thank you, Bill. Good morning. And good morning to everyone on the call. I'll give a quick update on tourism, sort of where we are, what's happened, and then sort of some thoughts and comments about where we go forward. Statewide, there have been 500, as of yesterday, there are 526 hotels closed, which represents about 40% of our standard hotel inventory. A couple of things. This does not include short-term rentals, does not include B&Bs, does not include Airbnb, HomeAway, and the like. We'll have those numbers here coming up in the next, I expect to get them on April 20th in regard to short-term rentals. But that number seems to have stabilized. It went up dramatically for quite a while. And actually the last couple of days, we've had a couple of hotels that have reopened around the state. So we seem to have bottomed out from the number of hotels closing. Some are closed by local ordinance, particularly in the Grand Strand area, but the majority have closed of their own volition. In regard to occupancy statewide, it has been in the 10 to 15% range. A couple of things we've noticed there, that it is higher during the week than it is on weekends, which indicates there is some corporate or business traffic, if you will. And it'll also higher on the interstate versus in metropolitan areas, which indicates that there are people traveling through the state, possibly the trucking industry and some others that are still using hotels at a normal rate. Also, the extended stay products like Residence Inn, Homewood Suites, and the like are faring better than standard hotels. In regard to air service, statewide, it's down 70 to 75% in terms of number of flights, but even worse, passenger traffic is down 90 to 95%, sort of slowly coming to a halt. Just a quick note on the storms that we had the day before yesterday, that morning that came through the state. We had 2 welcome centers had some damage, lost power. Welcome centers have been open during this time, but the one in Fairplay, which is Interstate 85 at the Georgia border, is still closed as there's still no electricity. In state parks, while closed, we did have significant trees down, as you can imagine, but no damage to any buildings or any persons, if you will. In regard to the recovery, where we go forward from here, just a couple of things. One, we've heard a lot of talk about the SBA. We've heard about PPP for the economic disaster recovery loans the SBA has and the like. There's also a pot of money that's coming to the states from the federal government as part of the stimulus plan, or CARES Act, if you will, that the states have control over to boost economic development. And the governor is literally, and he mentioned this in his press conference on Monday, but is literally in the process of putting together I don't want to use the word task force, that's probably not what it is, but something similar to sort of oversee this from an economic recovery standpoint. The good news is for us in tourism, we already have the infrastructure and mechanisms in place to get this money out on the street, if you will, to get heads back in the bed. So we know how to do this. So we'll certainly use that to our advantage. We are working on a recovery plan from a statewide perspective that we expect a lot of destinations. While each destination in our state is different, there are some overall echoing themes throughout our advertising and marketing that are the same. So we'll sort of coordinate those efforts from the state level down to each individual destinations. That will come out at the appropriate time. And I honestly, as much like most of you, I don't know when that is, but certainly at the appropriate time, we'll have that out there in the field. But there are no calls to action at this point, but there are a lot of social media taking place right now in terms of inspiration. So some of our campaign has been Dream Now, Discover Later. Is sort of what we've tagged it, but at the appropriate time, we'll have that out in the marketplace, if you will. But we know where our consumers are. Each destination around our state knows where our consumers come from. Some of those dynamics have changed, particularly in regard to travel. We think it's primarily drive market, and the drive market has expanded. People, I think, will drive further now. And it's also probably a crawl, walk, run process. It is possibly people going to a local park or state park at first, then getting in the car and taking an individual trip. And by individual, I don't mean one person, but an individual family or grouping of people together. Obviously, large crowds of festivals, sporting events, conventions are probably further down the road, more in the walk or run stage, if you will. So we're in the process of taking all that in. There are a tremendous amount of studies out there that are talking about consumer behavior, where they are right now, what they're thinking. A lot of data out there that's good. And so we think we can target those people to come back at the appropriate time, and we'll certainly do so. Bill, pending any questions, that concludes my report.
Thank you, Dwayne. Very, very good again. And I do have a couple questions for you. One is from Ansley, and Ansley's asking, why are golf courses remaining open?
Sure. Well, golf courses are one of the last outdoor recreation spots available for people where social distancing is quite easy. We mirrored what a couple of other states did, specifically Virginia and Arizona. For golf courses to stay open, they've done the South Carolina Golf Association, Low Country Golf Association, and a myriad of those around the state have been very good at having, for example, I'll give you a few things. Single carts, one person per cart to maintain distance, turning the cup upside down where the golf ball can be actually taken out of the hole without touching anything else. Clubhouses obviously are closed, only open for takeout or things to go. It's one of those places, there's not a lot open now for recreation, as most of you know, from beaches to lakes and the like. And so golf courses, the governor sort of deemed that was mirroring some of those other states. We thought that was a good thing to keep that practice in play, if you will. And also golf courses have not shown any sign, unlike some of the congregating places on sandbars or boats, tying up together out on lakes. Golf courses have not exhibited any non-social distancing, if you will. So we think the governor and I both thought that was important to keep those open.
Thank you, Dwayne. Another question for you from Lily. Why are Airbnbs not refunding deposits?
Well, it's an individual Airbnb decision. The Airbnb overall has a play. I honestly, tough for me to answer that question without seeing the individual reservation and what it is. But most rental companies and most Airbnbs, and I say Airbnbs, most B&Bs, some of that may be Airbnb, some of it may be something else, as Airbnb is a brand name. But most B&Bs and short-term rental companies have been very good about refunding, much like the airlines and hotel chains are doing right now, about refunding monies at the appropriate time. Certainly encouraging rebooking at a future date. But in regard to the individual reservation, difficult for me to answer without knowing what that is, what was in the original booking information in regard to reservation terms. Difficult for me to answer, Bill, without seeing it. But we're happy to sort of, we don't have authority to get involved in those, but I'm happy to make courtesy calls if anybody would like to send me that information.
All right, that's very kind, Dwayne, and thank you. Thank you for joining us again today. You all heard Dwayne talk a little bit about airports. We look forward to having our both airports back on the call next week. The CARES Act grant amounts has been released, and it's time for another update from each of our airports. So we'll hear from them next week. But Dwayne, we look forward to continuing the partnership and working on the recovery process when it's right.
Thank you, Bill.
You're welcome. We're going to transition now to education, and excited to hear from Dr. Frank Rodriguez, Superintendent of Beaufort County School District. Dr. Rodriguez.
Good morning, Bill, and everyone on the call. Just want to share a brief update with you. As you know, this is spring break for the school district, although it's different than our other spring breaks in the past, I'm sure. However, I just want to take a moment. You heard a little bit earlier from Hargray, and I just want to thank them again for the work and the effort that they're doing. Over 800 of our K-12 families have had packages installed and free installation and free service for up to 60 days. And that's really helped our families quite a bit. We also know that we appreciate them with the outreach collaborating with us to our Hispanic or Spanish-speaking families in order to gain access. And so they responded incredibly fast. So appreciate that partnership and collaboration to help our community. We're continuing with meals this week, even though we're on spring break. We are on a modified schedule for that, and so we're continuing to provide that. I believe by now we're over 130,000 meals that have been provided to our community thus far. We have added an additional component, and that is televised lessons. We have our teachers that are being videotaped delivering lessons in English and then some in Spanish as well for our K-2 students through the county channel. So that partnership is really been essential as well. And so those began airing on TV through the county channel. I remain extremely proud of our employees in the entire organization for all their efforts to support our students through this in a multitude of ways and capacities. And so I appreciate everyone in the organization. I appreciate our students for their engagement and our parents as well. Bill, it's a light report this week. We are on spring break. We look forward to next week getting back together, although it is online, with our students.
Thank you, Dr. Rodriguez. And each week I'm just amazed to hear the number of meals and how that increases each week in 130,000. But thank you to the great leadership and the wonderful things the district continues to do.
Thank you, sir.
You're welcome. We're going to move on now. Oh, Dr. Rodriguez, I'm sorry. Before we move on, I just see we have a question from Susanna. And Susanna is asking, do you know when there will be a decision and announcement made pertaining to the rest of the school year?
That is the $1 million question on all of our minds. And as you know, it's essential also as states begin to look at opening up their economies and all of that in the weeks ahead. That is a critical component because having our kids back in school is certainly an essential part of that. I have weekly conference calls with the state superintendent, and we had one yesterday. At this date, we don't have at this stage we don't have a particular date when that will happen. Although I do expect that we'll have a little more information probably at the end of next week because as we approach that time frame, we'll be getting closer to that April 30th date that we are currently closed through. So at this juncture, I don't have that information. So we remain sort of on the wait list on that to find out.
Okay, thank you. Thank you again. We're going to transition to Hilton Head Island, where we'll hear from Mayor John McCann and Town Manager Steve Riley.
Good morning. Bill, I want to thank you and the team for hosting these meetings. They've been very helpful to everybody. Our residents have been great, and I thank them for this. We must start thinking ahead of what society will require as we come out of the coronavirus episode here. A meeting of our community business leaders to include town mayors, town managers, county executives, can't start too soon. We must decide what the future will look like. And finally, I'd like to thank Jeremy Clark for his updates. It has been very calming and reassuring to our community. And I thank you, Jeremy. Now I'll turn it over to Steve.
Thank you, Mayor. A couple of things. First, we on town staff want to add our prayers and sympathies to our friends in Hampton County. Next, this is Telecommunicators Week, National Telecommunicators Week, and we want to thank our dispatch center staff, and we want to thank the county's dispatch center staff for all they do, particularly in this time, to handle the calls, to keep people calm and to gather the right information so that the responders are prepared with the proper protective equipment to handle those calls. We are in need of the N95 masks, and we're working with a lot of different sources trying to get those in place. But the other thing I want to talk about shortly, and it touches on something the mayor said and some other things that have been said here today. We heard from Dwayne the percentage of air travel that's off. I want you all to think a little bit about what would it take for you to get back on an airplane right now. And I want you to think about our Hilton Head Island Airport, which was a great airport when it opened, but then 9/11 came along and it proved to be a very terrible layout for dealing with the post 9/11 security needs that all airports had to comply with. We are under a deadline right now with FAA funding to break ground on a new terminal, a new airport terminal by this fall. And I would suggest that we need to reach out to our federal legislators and the FAA and try to slow that down. We need to gather some experts together and talk about what the airport of the future looks like. What is it going to need? I'm not smart enough to know. I think it's going to need a place where we can check your temperature, where we can isolate some people who may be ill. It's probably going to need wider aisles and bigger waiting areas. Think about how we stand in line right now to be screened, how we stand in line to get an airplane. Are we going to be willing to do that? What's going to have to change? And we should not be building the nation's last pre-COVID airport. We should step back and build the nation's first post-COVID airport and be a model for the country. The other thing we need to talk about, and there's a lot of things we need to talk about, is the Cross Island Parkway. Tolls are off right now. Do you and the visitors that come back want to engage with that toll taker? Do we want to be changing coins and dollar bills? It's scheduled to expire next summer. I suggest we work with our state legislatures to figure out how we make it stop right now and figure out a different way to pay off the final part of that bill. There's a whole lot of other things we need to work on. Walmart's got some great ideas. We've got the resources of big companies like Marriott and others who are here in our community. We can tap into those resources to help our smaller businesses that don't have those resources get the best in lessons learned and prepare ourselves for a future where we can still welcome people back to this island. And I'll shut up. Thank you.
Steve, thank you to you and the mayor for joining us. Some excellent things for us to think about and good takeaways there. Thank you very much. We'll shift to Bluffton, where we'll hear from Mayor Lisa Salka and Town Manager Mark Orlando.
Good morning. I'm in heritage mode, as you see, because we should be on the 18th green at this moment, but it will come back to. Just a couple of things. I don't want to drag on what everyone else said. Ditto to everything on all of our support. Couple of things we did. We had a meeting last night, trying to still walk and chew gum at the same time. We passed an ordinance extending the deadline to June 1st for the business license renewal, hospitality tax, and A-tax. And we also passed that we would waive any late fees that may show up on any bills. Our police department is taking the social distancing seriously. They're warning and they're citing violators. So don't try to bring 10, 12 golf carts to the promenade and hang around and have a little happy hour. Still continue to practice what has been ordered by the governor. A lot of amazing groups in Bluffton are really helping out, and it's even in extending to outside of Bluffton, some large groups that want to help us with all workers, unemployed school kids, hospitality. We have the Help for Hope that you mentioned. We have Hungry Heart Relief Fund. Bible Missionary Baptist Church is feeding 800 kids lunches on Saturday that don't get the school lunch, even though I think Dr. Rodriguez said they're going to start doing weekend lunches. Any kind of info on nonprofits you can find on our Town of Bluffton website. We're putting together a map on everyone doing something to help everyone. We are relying on our chamber to do the restaurant map. So we held off on that because y'all are doing such a good job on the grab and go places of restaurant takeout. We stay in touch. Jeremy, too, thank you for calling us often. We are also on calls with Beaufort Memorial, Hilton Head Regional, like with Jeremy. But very important, both of those are connected to MUSC. And I made a donation to telehealth this last week. And MUSC put me on an email blog, and they have a process that now they have a place they can set up for positive cases of corona to log in, so these doctors can now keep in touch with the ones and seeing how they're doing. So I thought that was a little innovative idea. We know how many cases there are, but we just aren't getting a lot of updates on where they are in the process. Finally, I heard someone talk about calling the elderly. The Bluffton PD has an amazing program called CARE. If you go to the Bluffton Police Department website, if you're an elderly person in the area, I don't think we limit it to the Bluffton zip code, but we may. And we have a group of volunteers that call them every day to check on them. So I would urge all of you to go on and look at that. I feel so bad for our high school kids. And if we as a group could think of ways to celebrate a time which all of us remember was the most important day in our life when we were seniors in high school, we got to think of a way to really celebrate them. They busted their tails to get through school. Some are going to the military, some are going in the workforce, some are going on to college. And I told Dr. Rodriguez, we are all about helping for our schools, and I know other areas will too. That's all I have. I don't know if Mark was on another call. I don't know if he's on this call, but he can fill in anything. And thank you again for doing this, Bill.
Thank you, Mayor. We wish we were with you at Harbortown right now.
It's beautiful. See?
It is beautiful.
I'm on the river, and now I'm on the 18th green. Right?
That's great. That's great. Thank you. Mark, are you with us this morning? I saw you on earlier. Not sure if you're still on.
Yes, sir. I'm here.
Great. Welcome.
Wonderful update from Mayor Salka. Not much to add. I will add a couple things. Definitely, Bill, to echo everybody today, a big thank you to you and your entire team for putting this together. I actually look forward to these calls every week, knowing I'm going to get a great update. We've had a council meeting last night, and we're going to have a planning commission at the end of the month. That seems to be a big thing, a big topic in our town, especially with all the development activity. We are keeping the projects going as much as we can within reason. And then we'll also be rebooting some more public meetings in May and probably bringing Historic Preservation Commission and a few other review committees back online. A big thank you, of course, to the medical professionals and first responders and all the frontline staff everywhere, not just at the town and municipality, but everywhere. We're showing our support and jumping on the Chamber's campaign of the Blue Ribbons. We have them at all of our facilities, town hall, all of our parks. I think I just got a text right now. I think they'll be done today, putting blue ribbons probably in place of the heritage banners this year up and down the street lights on Main River Road. And if you get a chance and you're bored at home, drive by some of our parks at night. We've also lit up some of our low-level lighting and replaced the bulbs with blue bulbs to honor and support and thank our medical professionals and first responders. And another big thing, and it's you'll probably hear a lot more of it in the coming week. We have a very informal, small task force assisting us with thinking through a small business resiliency plan. We've put together a survey to our business owners with Jonno Tools' help, with Beaufort County Economic Development Corporation. We also have established a Bluffton area resource guide. But we're putting together with our Don Ryan Center in the lead a proposal to town council to assist and facilitate small business during this time. So again, a big thank you to Hannah and a whole bunch of others that have been helping us along the way. Stay tuned on that. Right after this call at 11, I get on the phone with Steve Riley and Ashley Jacobs and a lot of other managers to compare some notes on that plan. So stay tuned. And that's my update. Thank you again.
Mark, thank you. Appreciate you joining us again today. Just had a message here from Aaron Wilburn. And Aaron says, we're looking at doing graduation on air with some clients that are willing to sponsor and provide scholarships. All DBC radio stations will be involved. So as we continue to think about graduations and the possibility or not having graduations, that's just something to think about that I mentioned. So I want to take this time now to thank each of our speakers and to each of you who tune in each and every week to get the latest updates from our leaders on the local, state, and federal levels. This week, we're usually hearing and the greeting and saying Happy Heritage. Last year's tournament is going to be televised this week on the Golf Channel. So on Thursday and Friday on the Golf Channel, you could tune in and watch last year's tournament. And then on CBS on Saturday and Sunday, you'll be able to watch the final two rounds. I know many of us are at the tournament each year and don't get a chance to see it. We know that from watching replays how well the island and the region shows on television, and I'd encourage you to tune in and to watch that. And then I'd also like to invite you to kick off the Heritage Weekend with our RBC Heritage Happy Hour. We're going to be doing a community-wide celebration as you gather with your family or virtually with any friends to say cheers to our community. You can find the details on the Chamber's social media outlets. So that should be a fun afternoon, and I hope that many of you will be able to participate on that. And so please join us next week again at 9:15 for our next community teletown hall. We appreciate all of you being part of today's call, and thank you to everyone and all the good works that you're doing in our community. Have a great rest of the day. Thanks again.